folks, David here. It's been 2 weeks since my bilateral hip replacement, and about a week ago I went and saw my local PT who prescribed me a whole bunch of strength and stretching exercises. A lot of them I actually demonstrated in the video. But the two stretches I found most beneficial have been the frog stretch, where you just let your knees fall to the side with gravity, opens up the hips, opens up the groin area. The other one is the knee to chest, bringing that in. That's really stretched the sides of my hips and my quads and all the sides of my legs. And I found that that's helped improve my mobility. I added one other stretch where I'm touching my toes, keeping my legs straight. My PT felt that I guess with anterior, the risk of dislocation is not so great, and I could get away with doing that. So he gave me the green light. With all these things, I've been super careful, only if it feels natural to do it, and I'm not trying to force or yank any of these stretches, just being very careful to do it. Also added the bike. Probably the biggest challenge with the bike is actually getting on the bike, because you've got to lift your leg over the frame. It's not that high, it's about a foot, but started off very gingerly lifting the leg straight to get over it. Now it's got to the point where I can actually have the knee bent and getting over it. But at the start, it was a bit of a challenge. Once you're on the bike, it's fine. Start off very slowly and built up to about 20 or 30 minutes, depending on how I feel. And again, not trying to push anything. If it feels good, I'll do it. Otherwise, I'll just back right off. The other thing I've added is walking. So I walked to the letterbox and back, which was around 150 meters. When I did that, I found that was actually challenging. I was sore on the lower back and on the sides of my hips. As that's improved, I've then increased the distance that I'm doing. Now I've got to about 400 meters, just halfway down a street and back. That's it. Nothing forced, just what I feel like, to the point where I think I've done enough and I just head back. The other thing that's really improved is sleep. So now I've been sleeping with a pillow between my legs, and I'm able to sleep on my side. And the pillow is just there to ensure that my legs don't cross, because I don't want to have that dislocation happen. They say if the legs cross over, you could risk that, so ensuring we prevent that. One of the more interesting things I've noticed is that most days I get something back that I'd either lost because of the arthritis or from the surgery. A couple of examples that spring to mind are, firstly, one morning I realized I wasn't using crutches. After 3 steps, I just wasn't using the crutches. And so I decided to drop the use of one crutch, or just rely on the one crutch, and then from there, drop it to no crutches. Another example was that my family noticed I'm walking without a limp, far better than what I was before. I guess I'm still probably walking with a little bit of a limp, but it's definitely improved a lot since the surgery. And probably the last example I can think of right now is I woke up one morning, started to put my socks on, and realized I wasn't using the contraption that I'd bought to help put socks on. And so I realized, I should be careful. And I think that was a result of the mobility exercises I was doing. And so from then on, I would be very careful about putting them on just by hand. And yeah, so that's been really good. But apart from that, it hasn't been all smooth sailing. Quads get pretty sore during the day, or sometimes they get really tight. And so I've been doing some quad stretches. The lower back also gets sore when I'm walking or just doing things. Some days are good, some days not so good. So I've been stretching that out and it has improved. So overall, there's been progress and improvement. And it's like anything, you take a couple of steps forward and then maybe one step back. It's never a straight line. And so I acknowledge that and just continue to work it through. Anyway, I'll be sharing more videos of me from week to week and hopefully we can track the improvement. Till next time, bye.